So you've just had an ultrasound, maybe for something completely different, and then bam, the report says fatty liver. It's one of those findings that can immediately make you think, uh-oh.
Definitely.
The big question we hear is, should you actually worry? Today, we're doing a deep dive into the source material, medical guidance, expert advice to figure this out.
Yeah, absolutely. And when that ultrasound says fatty liver, what it's seeing essentially is extra fat buildup inside the liver cells.
Yeah.
It makes the liver look brighter or maybe shinier on the scan image.
Right.
And, what often surprises people is just how incredibly common this is. It's probably one of the most frequent things picked up on liver imaging.
So it pops up a lot, often when you're not even looking for it.
Exactly. Found incidentally, as they say, during routine checkups or scans for other issues.
Okay, so our mission today, for you listening, is to really peel back the layers here. What does this finding truly mean? When is it just something noted, no big deal?
Yeah.
When does it genuinely need your attention? And maybe most importantly, what can you actually do about it? Let's unpack this.
Right, and a really key point from the sources is that in the early stages, especially if it's noted as mild and you feel totally fine, it's often quite benign.
Benign, okay.
Yeah. The surprising thing, perhaps, is that this fatty liver finding, it's less a cause for immediate panic and more like a signal from your body.
A signal, like a warning light.
Exactly like a warning light on your car's dashboard. It tells you something needs attention, but it's usually not an immediate breakdown. And crucially, it's often reversible with lifestyle changes.
Okay, so it's a warning light, not like engine seizure. Got it. But what happens if you just ignore that light flashing on the dashboard?
Well, that's where the potential risks come in. If it's left unaddressed, fatty liver can get worse. It can progress.
Progress to what?
We start talking about conditions like NAFL, that's non-alcoholic fatty liver disease, and that can sometimes develop into NASH-H non-alcoholic steatohepatitis.
Steatohepatitis. So that means inflammation.
Exactly. The hepatitis part means inflammation, so the fat starts actually causing irritation and damage in the liver.
Okay, that sounds more serious.
It is. And then, in a smaller number of people, if that inflammation continues unchecked, it can lead to scarring, which is called fibrosis.
All right.
And then severe irreversible scarring is cirrhosis, which really impacts liver function. And in rarer cases, even liver cancer.
Wow. Okay, so that progression is the real concern down the line. What makes that progression more likely? The sources mention risk factors, right?
Yes, definitely. Key risk factors that increase the chance of progression include things like obesity, type 2 diabetes, high cholesterol, or high triglycerides. Basically, other metabolic health issues often go hand in hand.
It's interesting how often it's silent, though. You might not feel anything wrong.
That's very true. It's often asymptomatic, which makes finding it incidentally quite valuable, really. It's an early heads up.
So you get the report, it says fatty liver. Beyond that initial oh moment, what's the very next practical step?
Well, first step is definitely don't panic, especially if it's just noted as mild.
Right.
While mild fatty liver alone isn't usually cause for, acute worry, it is that signal. Pay attention to your overall health.
So talk to your doctor.
Absolutely. Your doctor will likely want to do some additional blood tests.
Like what kind of tests?
Things like liver function tests, AST, ALT, to see if there's any sign of inflammation or damage. Also, probably a lipid profile for cholesterol, triglycerides, and maybe blood sugar tests like HbA1c to check for diabetes or prediabetes.
Okay, get the bigger picture.
Exactly. And they might suggest some regular monitoring, maybe repeat ultrasounds or blood tests every, say, 6 to 12 months. And crucially, you need to be aware of any new symptoms.
Symptoms like?
Unusual fatigue that doesn't go away, maybe some pain in your upper right abdomen where the liver is, jaundice, yellowing of skin, or eyes nausea, or unexplained weight loss. Report those promptly.
Right. But it's not just about tests and waiting, is it? It's about taking control.
Yeah.
What lifestyle changes do the sources really push?
Oh, they're very clear on this. Lifestyle is key. If you're overweight, even modest, gradual weight loss is probably the most effective thing.
Diet changes too.
Yes. A healthy diet, think Mediterranean style, lots of fruits, vegetables, whole grains, healthy fats, and importantly, minimizing processed foods, sugary drinks, and fried stuff.
Makes sense. Exercise.
Definitely. Regular physical activity most days of the week if possible. And a big one, alcohol. Limiting it significantly, or better yet, avoiding it altogether, is critical because alcohol can definitely worsen any liver issue.
Oh, okay. And managing those other conditions you mentioned.
Vital. Getting diabetes, high blood pressure, high cholesterol under good control makes a huge difference for your liver health too.
It really feels quite empowering knowing that something found by chance can often be managed, even reversed by your own actions.
It really is.
But when should you be more concerned? When does it tip from warning light to something needing more urgent investigation?
Good question. You should connect the dots and be more concerned if the ultrasound report specifically says moderate or severe fatty change. Sometimes they grade it, like grade 2 or grade 3.
Okay, not just mild.
Right. Also, if those liver function blood tests come back elevated or other blood tests are abnormal, if you do have those other conditions like diabetes or metabolic syndrome, or if you are experiencing symptoms like that persistent pain, jaundice, or really significant fatigue we talked about.
So those are flags for needing closer follow-up.
Yes, definitely. Those situations warrant further evaluation, potentially seeing a specialist like a gastroenterologist or hepatologist, and closer monitoring.
Okay, so let's try and summarize this deep dive. What are the absolute key takeaways for you listening?
Okay, first, fatty liver on ultrasound. Super common. Don't freak out immediately.
Right.
Second, in many mild cases, it's often reversible with those lifestyle changes: weight, diet, exercise, less alcohol.
Crucial point.
Third, do talk to your doctor. Discuss your specific risks. Get the recommended follow-up tests done to see the whole picture.
Don't ignore it.
Exactly. And fourth, if you have those additional risk factors, more severe findings on the scan, abnormal blood tests, or concerning symptoms, then yes, further investigation and closer monitoring are absolutely essential.
So here's maybe a final thought to mull over. Instead of seeing that incidental fatty liver finding as bad news that causes panic, maybe view it as a valuable early warning. It's actually an opportunity, an empowering nudge to proactively take charge of your health. It shows how a simple scan can sometimes be a real catalyst for improving your long-term well-being.